Hi, I'm Dr. Lippy, and this is Kathy Griffith. Kathy is one of our 6 audiologists in the Lippy group, all of whom have either a master's degree or a doctorate. Our chief of audiology is John Berkey. John's been with us a number of years, and John has written 2 textbooks on hearing aids. Kathy, do hearing aids really work? The patients are always asking me.
Yes, Dr. Lippy, they really do work. They help people to hear better by increasing the volume of sound. This really improves the quality of life by reducing isolation and loneliness from their family and friends. They also serve to help people with safety issues, like crossing the street, hearing traffic coming. So that's very important.
Kathy, let's talk a little more about the quality of life. What I find in our patients is that if one of the couple does not hear well, it causes a great deal of tension. You know, imagine the husband says to the wife, Agnes, is dinner ready? And she says, what? And he says, is dinner ready? What? Is dinner ready? What? Now, by the time he says it the 3rd time and he raises his voice, it gives the connotation of being angry. And couples find that they're angry with each other, or there's tension, and they don't even know why.
Mm-hmm.
Another thing that happens to patients is with decreased hearing is very often they withdraw. You know, if grandma is there or grandpa is there with the family, they try so long and they listen and they're not part of the conversation, then finally they just either leave the room or they just sit back in their chair and think about something else because they can't really partake in the conversation. Also, we find that patients with hearing loss, as you know, become paranoid very often.
Mm-hmm.
You know, if you're blind, you're blind. You know, you can't see and that's it. But if you're hard of hearing, you know, there are very few patients who are deaf. Most patients can hear something. So if you're hard of hearing, you very often become paranoid because you think people are talking about you. Yeah. So some become paranoid, some withdraw, and all couples find themselves very often at odds and tension, and they don't even know why. Kathy, there's one more benefit of hearing aids we didn't discuss in general, and that is the masking of tinnitus. Many patients are bothered by their head noises, and treating the head noises or the tinnitus is very difficult. But if we can introduce more sound into the ear, and the patient can hear what's going on around them, it masks out their tinnitus. So the best treatment for tinnitus is a hearing aid. Very often when a patient complains of tinnitus, my first thought is, I hope they have a hearing loss, because if they have a hearing loss, I can help their tinnitus by having them wear a hearing aid.